This is a program that I put together to hopefully help some of you out there that are suffering from low back pain. Now, I've been doing this for about 30 years, and I want to show you some exercises that I have had some great success with. Now, everyone is an individual, and everyone has their own individual orthopedic issues. Now, by the book, most disc pathologies happen in your early 20s. So yes, you have a disc bulge, you might have some pain, but you should know that if you took 100 people without back pain and you did an MRI on them, almost 70% of people would have a disc bulge on MRI, but they don't have pain. So just because you have a disc pathology doesn't mean that that's the driving factor or what's causing your pain. There's a lot of potential pain generators. Now, this program is geared more to those that are probably over the age of 40. So yes, in your 20s, you had a disc pathology, but as we get older, what happens is we lose disc height. As we get older, we get shorter, unless you do LDOA. If you do LDOA, you can maintain your height. But typically, as we get older, we get shorter. And when we get shorter, we start to lose those shock absorbers in between each vertebra, known as a disc. That disc is composed of a nucleus pulposus, which we'll call the jelly and the jelly donut, and the annulus fibrosus, which is the actual donut itself. And what happens over time is we start to lose that nucleus pulposus, and the disc, the little shock absorbers, get thinner and thinner, and the vertebra come closer and closer together. From what I see with my clientele, and if I'm working with people more so over the age of 50, yes, they may have a disc bulge on an MRI, but most people are suffering from stenosis. And stenosis is simply the narrowing of the two vertebrae together. Now, some signs and symptoms of stenosis would be you feel fine when you're sitting, but when you get to stand up and you go in a standing position, you have back pain. Or if you have to stand for long periods of time, you have back pain. But predominantly sitting feels better. Now, people say, well, if I sit for a long period of time, my back hurts. Well, of course it does, because we are not designed to sit. And when you sit for long periods of time, you don't get any pumping, any fluid movement. And remember, nerves love blood, but nerves do not have their own blood supply. They get their blood via movement. So of course, sitting for long periods of time for anyone is not comfortable. But predominantly, if you have stenosis, sitting will feel better than standing. And really another telltale sign is those people that lean forward on their knees like this, and when they're in my office talking to me and I ask them, does that feel good? And they'll say, yes. This is how I get relief, is I lean forward, I put my elbows on my knees, and that feels great. So what happens with stenosis is we talked about how the discs lose their height. So what happens with stenosis is we lose the disc height, and now what happens is we have what are called facet joints. So if we go up and down the spine, we have, here's your L5, L4, L3. We have an L5S1 facet joint on the right, an L5S1 facet joint on the left, and you come up, you have an L4, L5 facet joint on the right, and on the left, and vice versa, up you go. The facet joints have their own blood supply, their own nerve supply, their own capsule, and in a living human being, the facet joints actually aren't touching because of the fascia, but on this model, they do. So what happens when we lose the disc height, now we have the potential for the facet joints to come closer together. Not only do the facet joints come closer together, but now if you can see very closely, if we can zoom in, we have these little canals. And these canals are called foramen, vertebral foramen. Now you have a foramen on the right, you have a foramen on the left, and running down the middle of the spine is you have a central canal foramen where the spinal cord actually runs. Now the reason why I'm pointing out these canals on the right and on the left is because those are where the nerves come out that feed your legs. As we lose disc height, these little foramen, they get even smaller. And also too, when you sit, it puts you into a little bit of flexion. And when you go into a little bit of flexion, that opens the foramen. That gives you more space. If you go into extension, if you bend backwards, that closes the foramen and that decreases the space. Same thing happens in the central canal with the spinal cord. So, short, if you suffer from back pain and you feel better when you sit, and not for a long period of time, but when you go from standing to sit, you feel better, you probably are suffering from a little bit of stenosis. And in order to make that feel better, there are some exercises that we can do. Now, it's important if you have stenosis that we build strong abs, strong glutes. We got to make sure that your hip flexors and your quadriceps are nice and mobile, because those will pull you into an anterior pelvic tilt, and those will make the space even smaller. That pulls you into extension. So what I would like to do now is I'd like to take you through a few exercises that I'm hoping that will help you move forward and help alleviate some of your back pain. Now, the first thing that I would like to talk about is going from a sitting position to a standing position. A lot of my clients with back pain, they come in, they say, oh, it kills me when I come out of a sitting position. And here is why. Because when you're sitting, I'm going to turn sideways. When you're sitting, you remember you're in a flexed position. And a lot of times, I'm going to stand up here in a second, and a lot of times when you go to stand up and you drop into an anterior tilt and you come up into extension. So you've gone from a seated position with the spine open, and my mentor, Dr. Boy, always said, it's not my fault that God put the nerves posteriorly. So you go from a position of being open and sitting to standing in a position where you're closing down on the vertebra and you're closing the posterior space where the nerve runs. You're closing that little foramina where the nerve runs as well. And remember, you're also pinching the disc. And the discs do not move as fast as the vertebra. Think of your discs as putty or as chewing gum. They need a little bit of time to move. So if it's you that suffers from severe pain when you go from sit to stand, I want you to try to do this. I want you to try, but stand up, put your hands on your knees, go ahead and come up. But as you come up, I want you to tuck your tail a little bit. And when you get to this position here, I want you to roll yourself up from the base and come into a standing position. So I'm going to show you that again. So when I come to stand up, I'm going to put my hands on my knees. I'm going to lean forward. I'm going to come off the chair, but I'm going to tuck my tail, tuck. And when I go to stand up, I'm going to roll myself up from the base, from the top. So I would challenge you to try to do that when you're coming from a sitting position to a standing position. Now, maybe I should have taught you this prior to getting out of the chair. But what we want to do now is we want to talk about anterior and posterior pelvic tilts, or I like to give them cartoon characters. Anterior tilt is Donald Duck. Donald Duck had a big butt. Posterior tilt is Pink Panther. Pink Panther had no butt.